Welcome to the Deep Dive, your shortcut to becoming seriously well-informed, seriously fast.
Glad to be here.
You're tuning in because you want to cut through the noise and understand the core of complex topics. Today, we're diving into encephalitis. It might sound like a pretty niche medical term, but trust me, there are some genuinely surprising angles to this.
Exactly. At its heart, encephalitis is simply inflammation of the brain.
Yeah.
Pretty straightforward definition.
Right, inflammation, brain. Got it.
But that basic definition, well, it opens the door to a fascinating and surprisingly diverse range of causes and consequences.
Okay.
We've got some detailed text excerpts to work with today, and our goal really is to equip you with a solid grasp of the fundamentals.
The key players involved.
Exactly. And why understanding encephalitis can be, well, more revealing than you might initially think.
Okay, so encephalitis, inflammation of the brain. Our sources specify that this inflammation can sometimes extend.
Yeah, beyond just the brain tissue itself.
Right, to the spinal cord and the meninges. Those are like the protective layers wrapping the brain and spinal cord.
That's right. Think of them as the brain's protective coverings. Now, what actually triggers this inflammation? That's the key question.
Yeah, what causes it?
Primarily, it comes down to two main pathways, sort of two main categories.
Okay.
Either an infectious agent directly invades and inflames the brain. We're talking viruses, bacteria, fungi.
Even parasites?
Even parasites, yeah. Or the body's own immune system mistakenly targets the brain, causing inflammation.
Ah, the immune-mediated type.
Precisely. This is what we call immune-mediated encephalitis. And often the initial trigger for this immune system misfire, well, it remains a mystery. We just don't know why it starts.
So it's either an external attack or a case of, like, friendly fire within the body.
That's a good way to put it.
And while the main impact is clearly on the nervous system, the sources point out that in infectious cases, we might see signs affecting other organs too.
Yes, you can get multi-systemic signs, especially with infections. It's not always just isolated to the brain.
What about how often this occurs? Do we know?
Interestingly, we don't have precise figures on the overall incidence or prevalence of encephalitis. It's hard to pin down. However, it's really important to understand that the likelihood of encountering specific causes can vary significantly depending on your geographic location.
Ah, okay. So where you live matters.
Definitely. That's because the organisms responsible for infectious encephalitis have their own distinct distributions around the world. You know, certain bugs live in certain places.
That makes total sense, like how Lyme disease is more common where certain ticks live.
Exactly like that.
Yeah.
Now, our sources focus quite a bit on our animal companions,
Yeah.
particularly dogs and cats.
Right.
But it's not just a general dog or cat problem, is it? There seem to be some very specific breeds that are more prone to certain types of encephalitis.
Ah, yeah, I saw that. That's fascinating.
Absolutely. This is where things get really interesting and hints at some underlying genetic factors, perhaps.
Okay.
We see some clear patterns in dogs, especially with those immune-mediated encephalitis, where the cause isn't immediately obvious, like GME.
That's granulomatous meningoencephalitis.
That's the one. GME predominantly affects small breed dogs,
Okay.
especially terriers and miniature poodles. They seem particularly susceptible,
Wow.
though it can occur in larger breeds too. It's just much more common in the little guys.
So that strong link breed and specific type, that suggests genetics.
It's a powerful indicator, yeah. It suggests that specific gene variations within these breeds might make them more susceptible to these immune system malfunctions.
Which could maybe lead to genetic tests down the road.
Potentially, yes.
Yeah.
Or even targeted therapies eventually. It's a big area of research.
Okay, so terriers and mini poodles are key for GME. What other breeds were highlighted?
Well, pug encephalitis, as you might guess,
Affects pugs. Shocker.
affects pugs almost exclusively. Then we see pyogranulomatous meningoencephalitis in German short-haired pointers.
Okay, another specific one.
Yep. And Maltese encephalitis in Maltese dogs. And Yorkshire Terrier necrotizing encephalitis, or YNE,
In York.
Yorkshire Terriers. These breed predispositions, they strongly suggest a genetic component playing a role in these particular forms of immune-mediated brain inflammation.
That's quite a list. It really makes you wonder what those underlying genetic switches are.
Okay, so we've established the what's and some of the who. What about the how do we spot it?
Right. The signs.
What are the telltale signs that might lead someone to suspect encephalitis?
Well, the onset of symptoms is typically quite sudden, acute,
Not gradual.
usually not, and they tend to progress rapidly, often within just a matter of days.
Okay, fast progression.
And during a physical examination, if the encephalitis is caused by certain things like a fungal rickettsial.
Rickettsial. That's the tick and flea bacteria type.
That's right. So fungal, rickettsial, viral, or protozoal organisms. The source material notes that fundic lesions are frequently observed.
Fundic lesions. Changes in the back of the eye. Exactly. Looking into the eye can give you clues about what's happening in the brain, which is pretty amazing. It can be a valuable diagnostic clue.
Interesting. And then, of course, there's the neurological exam. That's where we start to zero in on which part of the brain might be affected, right?
Precisely. Depending on the location of the inflammation within the brain, you'll see different neurological signs. It helps localize the problem.
So if it's the front part, the rostral fossa.
Right. The rostral fossa, if that's involved, you might observe seizures, repetitive behaviors like circling or pacing,
Okay.
changes in personality, maybe aggression or unusual quietness, and a decreased level of responsiveness. Sort of not quite there.
Okay, so issues with higher level brain functions, personality, awareness. What if the inflammation is further back in the caudal fossa?
Good question. Involvement of the caudal fossa, which is the back portion of the brain housing the brainstem.
The brainstem, critical area.
Very critical. That can lead to somnolence, that's excessive drowsiness, a head tilt, facial paresis or paralysis.
Paresis being weakness, paralysis being total loss of movement.
Correct. Weakness or complete loss. And incoordination, like stumbling or staggering.
Okay.
The sources also describe a progression of signs that can indicate something really serious called tentorial herniation. Basically, brain swelling, pushing parts of the brain where they shouldn't be.
That sounds bad. What are the signs for that?
Things like unequal pupil sizes and anisocoria, pupils that are very small, pinpoint pupils, a declining level of consciousness, becoming less responsive, and poor physiologic nystagmus.
Nystagmus, that's the normal eye jiggle.
Right, the normal involuntary jiggling of the eyes when tracking something. If that's absent or abnormal, it can signal serious brainstem issues.
That sounds incredibly serious. So the specific symptoms really act as a map, guiding you to where in the brain the problem lies.
Exactly, they help you narrow it down.
Now, we've touched on some of the causes, but let's really delve into the sheer number of things that can trigger encephalitis, starting with dogs. The list in the sources is extensive, almost overwhelming.
It truly is. It highlights how vulnerable the brain can be. For dogs, the causes are broadly categorized.
Okay.
We've already discussed the idiopathic immune-mediated forms like GME and those breed-specific.
Right. The GME, Pug, Maltese, Yorkie types.
Yep. Then there's a significant number of viral culprits. I mean, the list is long. Canine distemper virus, rabies, herpes, parvovirus, adenovirus, pseudorabies,
Wow.
West Nile virus, and even Eastern and Venezuelan equine encephalomyelitis viruses.
Mm-hmm.
It's striking how many different viruses can target the brain.
Does the specific virus or bacteria significantly change how you approach it?
Oh, absolutely. That's a great question. The specific cause is critical for guiding treatment.
Right.
You'd manage a viral case very differently from, say, a bacterial or fungal one. And the list, it doesn't stop with viruses.
More causes.
Oh, yeah. It also includes post-vaccinal encephalomyelitis.
Inflammation after a vaccination.
Sometimes, yeah.
Yeah.
It can be associated with vaccines containing canine distemper virus, rabies, and canine coronavirus, parvovirus. It's rare, but it happens. Then we have those rickettsial infections we mentioned, Rocky Mountain spotted fever and ehrlichiosis
From ticks.
from ticks, and a whole variety of mycotic or fungal infections. Things like cryptococcosis, blastomycosis, histoplasmosis, coccidioidomycosis, aspergillosis, several others too.
Fungi, too. It's amazing how many different types of organisms can cause brain inflammation. And bacteria can also be a cause.
Yes, both anaerobic and aerobic bacteria can be involved, often from an infection spreading from elsewhere, like an ear infection or sinus infection.
Okay.
And we can't forget protozoal infections like toxoplasmosis, neosporosis, and encephalitozoonoses.
Protozoa, like single-celled organisms.
Exactly. Plus spirochetes like borreliosis,
Which is Lyme disease.
which is Lyme disease, right? And then there's parasite migration.
Parasites moving through the brain. Ugh.
Yeah, larvae of parasites like heartworm, roundworm, hookworm, even Cuterebra fly larvae.
Yeah.
If they migrate aberrantly through the brain, they cause inflammation.
Okay, that's grim.
It is. Even things like migrating foreign bodies, maybe a plant like a foxtail that gets lodged and migrates.
Seriously, a grass seed.
It can happen. And a condition called protozoasis, caused by an algae-like organism.
Algae.
Yeah. And finally, PME is also mentioned.
PME, polymyositis encephalitis. Muscles and brain.
That's usually what it refers to, yes.
Yeah.
Inflammation affecting both. So, you see, an incredible range just for dogs.
That is just mind-boggling. What about cats? The list as varied for them?
It's still significant, but maybe slightly less varied, with some overlap and some distinct differences.
Okay.
For cats, we also see idiopathic immune-mediated forms like GME, though less common than in dogs, and EME, eosinophilic meningoencephalitis.
Eosinophilic involves a specific type of white blood cell.
That's right, eosinophils. There's also idiopathic polyencephalomyelitis mentioned for cats again, idiopathic meaning we don't know the cause, inflammation of the gray matter.
And viruses in cats.
Definitely. FIP, feline infectious peritonitis virus, is a big one. Also rabies, FIV, feline immunodeficiency virus, pseudorabies, panleukopenia, and rhinotracheitis virus.
So FIP is a major player in cats.
Major one, yes. Mycotic and bacterial causes are similar to dogs, crypto, bacteria. Toxoplasmosis is the main protozoal cause mentioned for cats.
Okay.
And parasite migration can happen in cats too. Heartworm, Cuticle larvae again.
So some shared threats, but also key feline-specific ones like FIP and FIV playing a role. Given this really extensive list of potential triggers for both species, who is generally considered to be at the highest risk?
Well, several factors can increase an animal's susceptibility. Makes sense, right?
Yeah, who's more likely to get it?
Animals that are receiving immunosuppressive drugs, maybe for allergies or other immune diseases.
Their defenses are lowered.
Exactly. Or those with underlying conditions that suppress the immune system, like FIV or FLV, feline leukemia virus, infections in cats. They have a higher risk for infectious encephalitis because their immune systems just aren't fighting things off effectively.
Okay, immunocompromised animals. What else?
Geography plays a role again. Living in areas with a high tick population naturally increases the risk of rickettsial infections and Lyme disease.
Makes sense. More exposure.
And travel history is important too. Travel to certain regions can expose animals to specific fungal organisms, like coccidioids in the southwestern U.S. that they wouldn't normally encounter at home.
Right, picking something up on vacation, basically.
Essentially, yeah. It's all about exposure and the ability of the body to defend itself.
Okay. So if an animal comes in with these worrying signs, the seizures, the head tilt, the rapid progression, what steps do you take to figure out which one of these many possibilities is the actual cause?
The diagnosis. That's where a thorough and often multifaceted diagnostic process comes into play. It's not always simple.
I can imagine.
It's crucial to consider and rule out other conditions that can mimic encephalitis. Things that look similar but aren't actually brain inflammation.
Okay, what kind of mimics?
The sources mention things like fungal and protozoal diseases that might be systemic but affect the brain, rickettsial diseases, FIP in cats, canine distemper in young dogs, primary brain tumors, certain degenerative disorders, and even metabolic or toxic problems that can cause neurological signs like liver disease or poisoning.
So you have a big list of differentials to work through.
A very big list. It's not always a straightforward path to a diagnosis.
What kind of initial lab work might give you some important clues? Where do you start?
Basic blood work is usually the first step. A complete blood count, or CBC, a biochemistry profile, and a urinalysis. Standard stuff.
And what might you see there?
Often the CBC is actually within normal limits.
Oh, okay. So not always helpful.
Not always definitively helpful, no.
Right.
But it might show an elevated white blood cell count if there's a systemic infection brewing.
Right.
Sometimes you see lymphopenia, a decrease in lymphocytes, a type of white blood cell in early canine distemper, and rickettsial infections.
Okay, that's a clue.
And with rickettsial encephalitis specifically, we might also see low platelet counts and anemia. So the CBC can offer hints.
What about the biochemistry profile? Liver, kidneys, electrolytes.
That's also often normal. But you might see elevated total protein levels with a specific antibody pattern called a polyclonal gammopathy.
Meaning lots of different antibodies are high.
Exactly. That can be indicative of FIP in cats or other chronic systemic infections. It shows broad immune system activation.
Interesting.
And we might also see a mild elevation in creatine kinase, which is a muscle enzyme, sometimes with Neospora infection.
So blood work offers some initial hints, maybe points you in a direction, but it sounds like more specific tests are usually needed.
Exactly. Blood work rarely gives you the final answer on its own. There are various serological tests available, blood tests looking for antibodies against specific fungal, protozoal, rickettsial, and viral pathogens.
Antibody tests. So they tell you if the animal has been exposed.
They tell you if the immune system has responded to something, yes, but, and this is really important, you have to interpret these results with caution.
Why is that?
because a positive antibody test doesn't necessarily mean there's an active infection causing the current illness.
Ah, it could be from a past infection? Or even vaccination.
Precisely. It could just indicate past exposure or vaccination.
Hmm.
And conversely, a negative result doesn't always rule out active disease, especially early on before the body has mounted a strong antibody response, or with tricky conditions like FIP.
So titers can be difficult to interpret sometimes.
They can be. More specific tests exist, like IFA assays for ehrlichiosis, or ELISA tests for RMSF and toxo, which can be more informative, and antigen tests.
Looking for the bug itself, not the antibody response.
Exactly, like the latex agglutination test for Cryptococcus antigen. That can be very useful because finding the antigen means the organism is likely present.
Okay.
In some cases, analyzing the cerebrospinal fluid, the CSF.
Fluid around the brain and spinal cord?
Right. Analyzing that fluid for local antibody production within the nervous system against a specific bug, like canine distemper virus, can help confirm the diagnosis is happening right there.
Ah, finding the antibodies right at the scene of the crime, so to speak.
Kind of, yeah. It suggests the infection is active within the CNS.
So serology is a piece of the puzzle, but it sounds like imaging techniques also play a significant role. CT, MRI.
Absolutely. Thoracic radiographs, chest x-rays can sometimes reveal lung abnormalities linked to systemic infections that might have spread to the brain, like certain fungal diseases.
Okay.
Skull radiographs might show sinus or nasal issues, especially in some fungal cases in cats, but they're often not that helpful for looking directly at the brain.
Right. Need something more advanced.
Exactly. Advanced imaging like CT scans or, even better, MRI of the brain are often invaluable.
What can they show?
They can detect multifocal lesions, spots of inflammation scattered through the brain, or even single mass-like lesions that could be inflammation or even a tumor. MRI is particularly good at visualizing soft tissues like the brain.
Okay, so imaging is really helpful for seeing structural changes. And finally, the sources really emphasize the importance of cerebrospinal fluid analysis, the CSF TAP.
Yes, CSF analysis is considered pretty much essential in the diagnostic workup for animals showing signs suggestive of encephalitis.
Why is it so important?
Because it gives you a direct window into what's happening within the central nervous system's environment. In most cases of encephalitis, the CSF results will be abnormal.
What makes them abnormal?
Usually increased number of cells that's called pleocytosis. It's a direct sign the body is mounting an inflammatory response right there.
Fighting something off.
Trying to, yeah. If you find pleocytosis, bacterial culture of the CSF is necessary to check for a primary bacterial infection.
Okay. Does a normal CSF result mean no encephalitis?
Not absolutely.
Yeah.
A normal result doesn't completely rule out, say, an acute viral encephalitis that's limited just to the brain tissue itself and hasn't spilled inflammatory cells into the fluid yet. But usually it's abnormal.
And can the type of cells in the CSF give clues?
Yes, definitely. Examining the types of cells present can provide important hints. For example, a predominance of neutrophils often suggests an acute active inflammation, maybe bacterial. A higher number of small lymphocytes typically indicates the body is mounting an immune response to an antigen, could be viral, immune-mediated.
Right.
The presence of eosinophils can sometimes point to an allergic type reaction, or maybe a reaction to foreign material like a parasite, or even a tumor.
So CSF analysis really gives a direct look at the inflammatory activity and maybe hints at the type of inflammation.
Exactly. It's a cornerstone of the diagnosis.
Okay, we've gone through the detective work of diagnosis. What does the path to treatment and management typically look like once you have an idea of what's going on?
Right. Treatment. Initial management often requires hospitalization.
Makes sense. These animals are usually quite sick.
They are. Hospitalization is needed for both further diagnostics, maybe that CSF TAP or MRI, and to initiate therapy quickly. Nursing care focuses on supportive measures, primarily aimed at controlling brain swelling, or edema.
Which can be life-threatening.
It can be. And managing any seizures that may occur. Medications like mannitol, an osmotic diuretic, can help pull fluid out of the brain. Short-term use of corticosteroids can also help reduce brain edema, but you have to be careful with those depending on the cause.
Right, we'll get to that. And seizure control.
Managed with various antiepileptic drugs like phenobarbital or levetiracetam, depending on the situation.
Okay. And general supportive care.
Just keeping them comfortable, allowing the animal to be as active as it can comfortably tolerate. And importantly, withholding oral food and water if the animal is severely depressed or vomiting.
Why withhold food and water?
To prevent the risk of aspiration pneumonia. If they're really out of it, they might inhale food or water into their lungs.
Ah, okay. That makes sense.
And it's also really important to educate pet owners that relapse is possible, especially with the idiopathic or immune-mediated types.
So even if they get better, it might come back.
Yes, particularly when you start tapering off the medications. They need to be aware of that possibility. In some very specific complex cases, a brain biopsy might be considered to get a definitive diagnosis, but that's obviously a major procedure.
Right. And when it comes to specific medications, you said it really depends on identifying the underlying cause.
Precisely. The treatment approach is highly dependent on the cause. You treat bacteria very differently than fungus or an immune problem.
Okay, so walk us through some examples. What about the idiopathic immune-mediated types like GME?
For idiopathic and immune-mediated encephalitis, the cornerstone of treatment is typically immunosuppression, usually high doses of a corticosteroid like prednisone.
Steroids to calm the immune system down?
Exactly. And then that dose is gradually tapered down over a period of several months, sometimes even longer. It's a long process.
Okay. What about infections, say rickettsial or Lyme disease?
For rickettsial and Borrelia infections, the antibiotic doxycycline is the drug of choice.
Doxycycline. Got it. Protozoal infections, like toxo or neospora.
Those are often treated effectively with an antibiotic called clindamycin.
Okay. And fungal infections, you mentioned those can be tricky.
They are. Mycotic infections typically require long-term treatment, often for a year or even longer, with antifungal medications such as itraconazole or fluconazole.
A year or more. Wow.
Yeah, fungi are tough to clear from the brain. And in fungal cases, corticosteroids are often used initially, alongside the antifungals, to help manage significant brain swelling.
Okay. And what about viruses, like distemper or post-vaccinal cases?
Unfortunately, for viral and post-vaccinal encephalitis, there are no specific antiviral treatments that are proven effective.
So what do you do?
Management is focused on supportive care, helping the body fight it off, controlling seizures, reducing swelling, nutritional support, basically helping the patient through the illness.
Okay. And bacterial infections?
Those are treated with broad-spectrum antibiotics that have the ability to effectively cross the blood-brain barrier.
The blood-brain barrier,
Yeah.
that protective layer that keeps things out of the brain.
Exactly. Not all antibiotics can get through it well. So you need ones that can penetrate, like combinations of enrofloxacin and tecursilin clavulinate, or maybe amoxicillin clavulinate with something else. Depends on the suspected bacteria.
Are there any specific medications that need to be avoided in certain situations, contraindications?
Yes, definitely some important ones. Corticosteroids, which we use for immune cases,
Right.
are generally avoided if you suspect or know there's a bacterial infection, because steroids suppress the immune system you need to fight the bacteria. They're also generally avoided in Rocky Mountain spotted fever.
Okay, no steroids for bacterial or RMSF, anything else?
The antibiotic chloramphenicol, while it crosses the blood-brain barrier, should be used with caution in very young puppies, under 6 months, with rickettsial disease because of potential tooth discoloration issues.
Ah.
And enrofloxacin, a common antibiotic, is generally contraindicated in puppies younger than 8 months old because it can potentially damage developing cartilage.
Okay, age restrictions there.
And it's worth remembering that certain classes of antibiotics like aminoglycosides or older cephalosporins just aren't very effective for CNS infections because they don't get into the brain well enough.
Right, that blood-brain barrier again.
Exactly. There are also precautions like maybe giving mannitol before doing a CSF tap if there's concern about high pressure, and watching carefully for worsening infectious signs if you do have to use corticosteroids for swelling alongside antibiotics.
Lots to juggle.
It is. And potential drug interactions too, like some drugs affecting how phenobarbital for seizures is metabolized. Corticosteroids can also change CSF results, so the timing of tests matters.
What if the immune-mediated cases don't respond to prednisone? Are there alternatives?
Yes, for cases unresponsive to conventional steroid therapy, there are alternative immunosuppressive drugs like leflunomide or mycophenolate mofetil.
Okay.
But these also require careful monitoring for side effects like bone marrow suppression or gastrointestinal upset. They aren't used lightly.
Those are important caveats to keep in mind. So once treatment starts, what about the follow-up care? And what can pet owners generally expect in terms of the prognosis?
Follow-up is critical. Close and frequent monitoring of the patient's neurological status, especially in the initial days and weeks, is absolutely crucial.
Checking for improvement or worsening?
Right. If a patient relapses as medications are being tapered, maybe the head tilt comes back.
Yeah.
A repeat CSF analysis might be needed to see if the inflammation has flared up again.
Okay.
For fungal infections like cryptococcosis, we can track the cryptococcal antigen levels in the blood. It's a useful way to see if the treatment is working. The levels should go down over time.
That's helpful. What about prevention?
Well, in areas where ticks are common, year-round, effective tick control is a really vital preventative measure for tick-borne causes.
Makes sense.
And in dogs that have a previous history of GME, that immune-mediated type,
Yeah.
vaccination is generally avoided or done very cautiously due to the theoretical concern of stimulating the immune system.
Okay. Any major complications to watch for during or after treatment?
Well, long-term side effects from prolonged corticosteroid use are common things like weight gain, increased thirst and urination, panting, muscle wasting, susceptibility to infections.
Right. Steroid side effects.
And the most serious potential complication is tentorial herniation and death. That can happen either from the disease itself causing too much swelling, or very rarely as a complication after CSF collection if the pressure changes rapidly.
That's sobering. So the expected outcome, it really depends hugely on the underlying cause, doesn't it?
It varies considerably.
Yeah.
Massively. In many treatable cases, like maybe bacterial or rickettsial if caught early,
Yeah.
we generally expect to see a gradual resolution of clinical signs over about 2 to 8 weeks. But it takes time.
Okay. Gradual improvement. What about the really bad ones?
Unfortunately, encephalitis caused by protozoa, that algae,
Yeah.
has a very poor prognosis, almost always fatal according to the sources.
Oh, dear.
For immune-mediated encephalitis like GME, with aggressive and appropriate treatment, the prognosis for achieving remission can range from fair to good. But relapse is common, and long-term medication is often needed.
So manageable, but maybe not curable.
Often, yes. Rickettsial, mycotic, bacterial, protozoal, and spirochete infections generally have a fair chance of survival if diagnosed accurately and treated appropriately and early enough.
Okay, fair chance for those.
However, conditions like encephalitis due to parasite migration, migrating foreign bodies, PME, YNE, the Yorkie type, and idiopathic polyencephalomyelitis, they typically carry a poor to grave prognosis, often fatal.
Wow, some of those are really tough.
They are. Pug encephalitis and Maltese encephalitis can have variable outcomes. Some cases can be fatal quickly, while others might respond somewhat to long-term steroid therapy, but again, the prognosis is guarded.
And post-vaccinal.
Post-vaccinal encephalitis sometimes resolves spontaneously, which is good news. But it can also lead to permanent neurological damage or even death in some instances. It's unpredictable.
So a really, really wide spectrum of potential outcomes. It all comes down to what's actually triggering that inflammation.
Exactly. Finding the cause is paramount.
Well, that's a truly comprehensive look at encephalitis. It's definitely way more than just simple brain inflammation.
It really is. It's a complex medical condition, or rather a syndrome, with just a vast array of potential underlying causes. Everything from direct infections by viruses, bacteria, fungi, parasites,
Right.
all the way to malfunctions of the body's own immune system attacking itself.
And getting the diagnosis right, often relying heavily on that CSF analysis you mentioned.
Absolutely critical. Accurate and timely diagnosis is crucial for guiding the selection of appropriate and hopefully effective treatment strategies, tailoring the treatment to the cause.
And hopefully this deep dive has provided you, our listener, with a structured and, understandable overview of what can be a really overwhelming medical topic.
We hope so.
It's quite remarkable, really, when you stop and think about just how many different things, infections, immune mistakes, even weird things like migrating grass seeds, can disrupt the function of an organ as vital and complex as the brain.
It truly is. This exploration into the brain's inflammatory responses, it really underscores the incredibly intricate relationship between a living organism and its environment.
Both internal and external environment.
Both. The internal environment of the immune system, how it works, how it can go wrong,
Right.
and the external environment teeming with potential infectious agents and other threats.
Yeah.
It certainly raises some fascinating questions about how these diverse factors interact, doesn't it? And maybe what other inflammatory processes might be at play within the nervous system that we are only just beginning to understand.
Definitely food for thought. What further lines of inquiry does this exploration spark for you listening in?